All righty. Well, welcome everyone. We're so excited to have you be a part of the Link and Learn this week as part of Fall Prevention Awareness Week. You're going to come out so much smarter and wiser, as I hope I am too, with this great presentation that we have. Just welcome you to our webinar. It's medications, which ones may increase your risk for falls. And this is actually one of a 5-part series on active steps that you can take to identify risk factors related to impaired balance and how you can prevent falls. We hope that you have the opportunity to join us for several or even all of these lunchtime Link and Learns topics during Fall Prevention Awareness Week. So we'll have this one today, and then one Wednesday, Thursday, and Friday of this week. My name is Karen Cohn, and I will be your moderator for today's session. We ask at this time to make sure that your microphones are kept off during the presentation. You're welcome to keep your video camera on, but if you find that your connection's poor, you may want to turn your video off. Both of the controls for your microphone and your video are on the lower left corner of your screen. If you are calling by your phone, you can press *6 to both mute and unmute your phone. And then we will have someone on our end that may also be able to assist with this action if you're having some difficulty. But *6 will mute it and also unmute it. As you think of questions for our presenters, use the chat button at the bottom of your screen to type in your question, and we'll answer all questions either live or in the chat following the presentation. You may also click on the raise your hand icon at the bottom of the screen, and we will assist you if you need help turning on your microphone to ask your question at the appropriate time. If you're calling on your phone, we'll give you an opportunity to unmute and ask your question as well, using that *6 function when prompted. So now I'd like to present to you our speakers for today's presentation. We have Dr. Courtney McCaughey, and she is graduated from Regis University School of Pharmacy in 2019 before completing her first year of residency at Ascension St. Francis Hospital in Milwaukee, Wisconsin. Currently, she is completing her second year of residency in ambulatory care with the University of North Texas Health Science Center. We also have Maryann Contreras. She has been a nurse for 38 years, specializing in the field of trauma, emergency, and critical care. Her practice comes from a compilation of experience in the state of Texas, Virginia, and Florida. Currently, she is the Violence and Injury Prevention Manager at APS Health Network, the Level 1 Trauma Center in Fort Worth, Texas. In this position, she studies trauma, behavior, environment, and policy to develop, implement, and evaluate prevention initiatives. She is active in regional and state trauma advisory councils, the Texas Injury Prevention Leadership Collaborative, and other community collaborations. Maryann was named one of the DFW Great 100 Nurses for 2019. So thank you again for joining us today, and I'll now turn it over to our presenters. Thank you, ladies.
Good morning, thank you.
Yeah, excuse me, yes, thank you for the introduction. If we can go to the next slide, we can go ahead and get started. So after the presentation, it is our wish for you to be able to understand that our bodies metabolize medications differently as we age and understand why this is. We also want you to be able to identify potentially inappropriate medications that may lead to adverse effects or unwanted side effects that could increase a person's risk of having a fall. And then also we are going to talk about and hope that you are able to recognize orthostatic hypotension and understand ways to manage and prevent orthostatic hypotension from occurring. Next slide, please. So the CDC reports that every 11 seconds, an older adult is treated in the emergency room for a fall, and this number is far higher than any other age group. So why are patients 65 years and older more likely to experience a fall? Well, this is because as we get older, our bodies begin to metabolize medications differently, and it becomes very common for the liver and the kidneys to slowly decline, which in turn decreases how much they're able to metabolize. And this can actually start as early as age 40. So when our bodies are more slower to metabolize these medications, that means it's taking longer for our bodies to clear the medications. And we begin to see this kind of buildup in the body, which can turn into unwanted side effects. And you can kind of see this compound on itself when it's time to take the next dose, because our body still hasn't properly used up and gotten rid of the last dose. So you kind of see this altered metabolism and decreased clearance. And some medications are more likely to cause some of these unwanted side effects that can lead, especially an older adult, to be at a higher risk of experiencing a fall. And we'll actually talk about some of these medications on the next slide here. So medications are among the most common cause of increased falls in older adults, and it's also one of the easiest risk factors to change. You may or may not be surprised to hear that it is extremely common for older adults to be taking medications that have been associated with an increased fall risk. Generally, there are 3 different types of medications that can increase someone's risk of falls. And these kind of fall into like more broad categories, such as medications that affect the brain, because these tend to cause sedation or drowsiness and can also cause or worsen confusion, as well as medications that can affect the blood pressure, which we'll talk about a little bit later, and then medications that can affect blood sugar as well. So most of the medications on this list will affect kind of the brain. And then later on in the presentation, we'll talk about kind of the risks of what happens when you experience a sudden drop in blood pressure. But for now, I just want to focus on some of these common offending agents that have frequently been shown to cause falls in older adults. Now, I do kind of want to try to make it clear that some of these medications, don't need to be labeled "do not ever use," because some of them will have a place in therapy, but this is just to alert you to medications that may potentially be inappropriate due to their side effect profile. So drugs like benzodiazepines, such as like Xanax, Valium, and sleeping medications that are commonly used to help a patient fall asleep or stay asleep can cause excessive drowsiness and sedation for a patient that can in turn cause them to be unsteady on their feet. I also wanted to point out that some over-the-counter medications, such as Benadryl, can also cause kind of pretty heavy sedation in patients. So it is important when you go into your doctor's office to kind of let them know any medication changes that you've had recently, including over-the-counter medications, because some over-the-counters can increase a patient's risk of having a fall. And then other antidepressants or skeletal muscle relaxants, such as Zoloft or Prozac, again, are going to more commonly affect the brain, which can really cause a patient to become a little bit more drowsy and a little bit more unsteady on their feet as well. So these common offenders, it is recommended to avoid these medications in anyone older than 65 because they have been shown to increase the risk of having a fall. We will talk a little bit more about side effects on the next slide, but all of these medications are associated with a higher risk of fall because of the side effects that they can lead to. Like I mentioned before, some of these medications may be appropriate for some patients, but that's why it's really important to take medications only prescribed by your doctor and how your doctor prescribed the medication, because taking too much can increase your risk of having a fall. We can go to the next slide, please. Thank you. So these are the side effects from the medications listed on the previous slide that can cause any person really, but especially a person with more advanced age to experience a fall. Not only can one of the medications on the previous slide cause, dizziness and drowsiness, but they can slow down a person's reaction time and then make them more unsteady on their feet. Sometimes, patients may try to kind of time these medications a little bit differently, especially some of the more heavily sedating medications, and they might be more inclined to take them at night. But what I've seen in the past is patients are really at risk of having a fall if they take some of these like highly sedating medications at night and then they wake up in the middle of the night to use the restroom. A lot of times patients can have a fall in the middle of the night too, especially if they're not using their walkers or other kind of like preventative measures. So for medications kind of such as these, sometimes there isn't really a way to best avoid the side effect, but on the next slide, we will talk about what strategies we do have. Okay. So Having open dialogue and communicating with your primary care provider or pharmacist is key to managing side effects. Once you recognize any changes to your baseline or any perceived side effects you may be experiencing from your medication, it's important that you alert your primary care provider or pharmacist about the change to your baseline. And really, most importantly, being open and receptive to change. I just want you to know that it's very normal to have to reduce the dose or get off of a medication that you may have been on for years because your body is not metabolizing it the same anymore. A good way to help prevent a fall is having a pharmacist do an annual medication assessment and risk assessment for you so they can identify any potentially inappropriate medications that you may be taking, and then they can take action from there. If your healthcare team kind of knows this information and knows that if you're on any kind of like at-risk medications, it's possible for them to either reduce the dose, stop the medication, or find an alternative agent that would work for you. I just want to, really stress that it's so critical to alert your healthcare team when you do notice a difference in your baseline. The CDC reports that 1 in 4 seniors fall each year, and less than half of those that fall tell their doctor. And it has been shown through recent studies that falling once can double your chance of falling again. And it is important to remember that falling is not a normal part of aging. So alert your healthcare team if you have a fall or are experiencing side effects that would put you at a higher chance of having a fall, such as kind of like dizziness on standing, drowsiness, a little bit more of like an unsteady gait when you are walking. Because these are all ways that, potentially your healthcare team can adjust so that you do not have these high risks for you. We are going to move on to other non-medication related factors that can cause a fall and strategies to prevent this from happening. So Maryann, I'm going to turn it over to you.
Thanks, Courtney. Great job. So I'm going to talk a little bit about orthostatic hypotension, which you can read at the top of the slide is a sudden drop in blood pressure caused by a change in your posture, in the way that you are. Blood pressures in the arteries fall below normal levels, and it causes you to become dizzy. Your body's ability to react to drops in blood pressure can slow down as we age. And in my institution, Karen mentioned that I work at JPS, and what we are seeing and what we are treating are people not only 65 and up, but in the trauma world, we count people that are 55 and up as a senior citizen. So orthostatic hypotension can come from a variety of reasons, and it can come from a change in your position. So maybe when you're sitting down and you stand up quickly. Another cause of orthostatic hypotension, low blood pressure, is when you have high blood pressure and you change your position. Another cause is alcohol can change and cause you to have orthostatic hypotension. If you're dehydrated, if you've been in bed for a long time, been ill for a length of time, and you haven't been up in your normal and activities of daily living, and you're just, you've been recuperating, which is what you should do. But when you go to get up quickly, you may notice a sudden dizziness or a feeling of unsteadiness. And again, with illness, that can cause it as well. Something else that we see in the hospital that impacts older folks is a lot of people develop an anemia, and that can also cause orthostatic hypotension. Courtney already mentioned medications that can cause orthostatic hypotension, and it gets compounded when you change that position in a quick manner. Yeah, next slide, please. So I like to have fun slides. So that's a picture of Dizzy Gillespie. So here's how you recognize if you have orthostatic hypotension, not like Dizzy Gillespie, but his first name, Dizzy. Maybe you stand up and you begin to feel a little out of kilter, a little out of sorts. That could be a sign of orthostatic hypotension. It can come on really quick, and it can even make you feel faint, like getting the tunnel of vision. You'll have visual changes that can include that tunnel vision, as well as even blurry vision and inability to really be able to focus. So it's really important that you recognize these signs of orthostatic hypotension and that you sit down carefully And if it doesn't go away after a few minutes, you could put your head between your knees to help level things out within your body. So recognizing those signs, you can see on the picture there, the people look a little bit blurry as well. And there's a little photo of tunnel vision. Recognizing those signs as orthostatic hypotension can help avoid a fall, because when you recognize it, you know that there's something you can do about it. Next slide. So when your blood pressure drops, less blood goes to your organs and your muscles, and this can make you feel much more likely to fall. You can experience a sudden weakness. You can get sweaty, like you're about to faint. And some people describe orthostatic hypotension as an extreme tiredness. They just are exhausted and they can't seem to get what they want done. A decrease in blood flow to the brain cells can also cause some confusion, much like the medications that Courtney was talking about earlier. Any change in the blood flow to the brain can also make you feel a little nauseous, a little sick to your stomach. So these are things that you really want to keep an eye on and recognize and not just put off. Getting in a safe position is so important. When you get in that safe position, such as sitting down, take some deep breaths, or even lying down, especially on your side, can also help you gain back your normal tensive, your normal blood flow to your brain and to your organs. Next slide. Courtney mentioned how important it is to talk with your provider or with your doctor. And that is so right. You always want to let your doctor know, let your provider know when you are when you have a sense of dizziness. There may be some adjustments in those medications that she talked about. They may need to be changed, as she talked about, or reduced as we age. So even today, I'm sitting here in my dad's study in Florida. I came to see them to visit with my folks. And my father has had some orthostatic hypotension. And so what they did was they took a look at his blood pressure and decided, as he's aged and he's lost some weight, he doesn't even need his blood pressure medication. Now, the key to that is talking with your provider. You always have to check with your provider. And they did several checks on him to determine that, nope, you don't need it anymore. And his orthostatic hypotension has resolved. So you want to take your time when you change positions, whether it's from laying down to sitting up to standing. So like first thing in the morning when you're getting up and getting ready to get out of bed, don't just pop out of bed. Wake up a little bit, stretch, wiggle your fingers and your toes, and then just sit on the side of your bed for a few minutes. That helps your body to normalize its blood pressure. It helps to normalize the way the blood is entering the brain and all your different organs. So after you sit for a few minutes, then it's okay to get up. You can see in my slide there, I have a picture of a walker, which is also very important. Some people in their homes don't use their assistive devices, and assistive devices can save you from falling, can also help when you're experiencing some kind of dizziness due to orthostatic hypotension. It helps to steady you a little bit. So keeping those by the bed, so when you do stand up, and you've got a little bit of help to make it across the room to hit the bathroom first thing in the morning, right? Besides taking your time when you're laying down to sitting to standing, other things that we've talked with patients about in my institution is taking your time when you're answering the front door. That's something practical you can do. Don't rush, don't hurry. Whoever's there will be there. The same with your phone. You want to either keep your phone nearby you or just take your time to answer it. It's okay if it has to ring a little bit. People rushing here to get the phone or to get the door increases your risk to have a drop in blood pressure and to potentially fall. Water, you can see in that picture, is very key to maintaining homeostasis. That's the ability to have your body maintain a relatively stable blood pressure throughout your organs and your brain. And so water is really important. All organisms, from plants to puppies to all people, have to regulate their internal environment so that they can maximize your homeostasis, your ability to stay upright, right? So drinking water is so important. what we see at JPS with patients who fall is many times they'll come into the emergency department because they've fallen, and they come in to get checked over. And anytime someone comes to the hospital, we always do a little bit more investigation, and we may do some lab work. And we find that many people who fall have a very low case of maybe either a respiratory infection or a bladder infection. And those things can be triggered by not drinking enough water. So you want to make sure that even that you drink enough water throughout the day. And even though it sometimes makes you get up in the middle of the night to use the bathroom, it's still really important to maintain your water intake. Well, I'm just checking over my notes. And the other thing is that people have a tendency, as I mentioned earlier, to hurry up and get things done. But it's okay to take a rest and to sit down until you can get your balance. Take rest when you're performing your everyday tasks at home or at work, or when you're out and about. Take your time when you're cleaning and when you're cooking to take some time out to sit down and make sure you have your balance. Next slide. So our goal is to maintain independence, right? We all want to stay independent. My folks are in their mid-80s here in Florida, and they're very independent. And we always want to be able to maintain our independence so we can enjoy our quality of life. And you can do this with really simple steps to recognize, manage, and prevent orthostatic hypotension through your medications, as Courtney was talking about, and through other simple measures that I mentioned. Next slide. So, do you guys have any questions? I'm looking in the chat box.
We don't have any questions in the chat box, but I did have a quick question. You mentioned, making sure that we drink plenty of water throughout the day. Do you have a recommendation as far as how much water, or I know it may depend on what medications we're taking, but I didn't know if you might have a good guideline?
Yeah, Courtney, do you have any suggestions with that regarding the pharmaceuticals that many of our senior citizens take?
So some drugs like diuretics for blood pressure will make you use the restroom a little bit more often. So for those patients that are on like hydrochlorothiazide or chlorthalidone, those are pretty common blood pressure medications. Since you'll be going to the bathroom more, you're going to want to be intaking a lot more water. So really kind of the recommended, which does seem high, but 8 ounces of water a day, so 64 ounces is kind of recommended, especially for those on like a diuretic. And that is kind of the goal for everyone. Getting, somewhat close to that or manageable for that. A lot of times as we age, we don't feel as thirsty, but like you were saying, hydration is so important. So even if you don't feel thirsty, it still might be appropriate even just to take a little sip of water to make sure that we just have kind of a pretty consistent intake of water or hydration throughout the day. But for some of those kind of like more diuretic type medications, the goal really is about 64 ounces of water a day.
Yeah.
Thank you. And Courtney, you mentioned the annual medication assessment, which I thought was really interesting. Is that something that most doctors that are geriatricians or that are working with the older population, are they encouraging that? Or is that something that we as patients need to make sure that we're asking for?
Absolutely. So I have seen a lot of doctors be a little bit more kind of like aggressive or proactive with this, and they are doing medication assessments. But it is so important for a patient, to really kind of take ownership of their health as well. So if you feel like it's been about a year or so since you last had a medication assessment, or likewise, if you've started any new medications, even if it's an over-the-counter medication, it's just important to let your doctor know and then ask them, are there any medications that, that could potentially cause me to have a fall? I just want to do an assessment on my medication and do a risk assessment for falls. So it is important to have that conversation with your doctor. They should be looking for it, but it's just something for, patients to also realize that, they can ask for that at any time during their care too.
That's
And
great.
I'll brag a little on Courtney, Karen. And I do know that a lot of pharmacists in town, when I say in town, your local pharmacist, you can take your whole list of medications to your local pharmacist and go, hey, could you just take a look at these? Because I just was at the doctor and I forgot to ask them to, go over this, or maybe you didn't remember what they were saying when they did go over it. Just go over it. And your pharmacist at where you get your prescriptions filled can also review those medications.
That's great. And I think that's one of the things you guys mentioned about it's important that we also include those over the counter, because that's one thing I think we forget sometimes is, the little supplements that we might take or that we've heard great, they can have an impact. So I appreciate y'all sharing that. Well, I don't know if we have any other questions. If anybody needs to come off of mute, they can, or if you're on your telephone, it's *6. I'll give it just a minute.
I see we have a question on the chat, and it says, what if a patient gets medications from several physicians? So like my mom and dad, my mom today had to go to her chiropractor, and now she's at her cardiologist getting her checkup and everything. So she's got different doctors that prescribe different drugs. And believe it or not, as much as we'd love to say all doctors talk to each other in the medical field, that is not common. They don't. And it's because they're busy and they're focused on their specific area of specialty. So what we recommend, and I know Courtney does too, is that you keep a list of all your medications, whether it's on your phone or you can put it on a little 3x5 card and slip it in your wallet. And every time you go to any doctor, you go, hey, could you just take a look at this? Here's what all I'm taking, which is really important because your cardiologist may not know that your chiropractor is prescribing a muscle relaxant and your cardiologist has you on some blood pressure medicine that might interfere with each other. So keep that list of medications with you at all times, whether, as I said, it's in your wallet. That's where I keep mine, is in my wallet. Anytime I'm anywhere, I can just pull it out and go, you can make a copy of it, because you know how they always ask you, could you give us a list of your medications? And you can pull out that piece of paper and go, here, you can make a copy and stick it in my chart. One less thing for you to do.
That is great. That's great. All right. Well, that is so super informative. So I appreciate both you ladies in presenting to us and sharing some of your tips and your great wisdom. And I think all of us can put these things into practice, most definitely. For those of you that are joining us, we will have another great presentation tomorrow. It's going to be How's My Balance? How Safe is My Environment? And we'll have a local physical and occupational therapist presenting tomorrow. So again, thank you both so much for being here today. Thank you to those who have attended, and we hope to see you out there safely very, very soon.
Thank you.
Thank you so much.
Bye-bye.
Bye, everyone.